Well, hey guys, today let's talk about skincare while you're undergoing radiation therapy. Previously, I did a video all about skincare for people going through chemotherapy, so definitely check that out if that's something you're also going through. But today we're going to focus on how you may need to change up your skincare routine and your approach to caring for your skin while going through radiation therapy. Skincare needs for cancer patients are unique. It is without question that the various therapies used to treat cancer, whether it be chemotherapy, radiation therapy, they do have side effects for the skin, and in some cases they can lead to really adverse side effects, toxicities for the skin. A basic skincare routine and some of the skincare tips I'm going to share with you in this video not only can help reduce painful side effects, redness, irritation, but they may also prevent you from developing more serious skin side effects that actually could result in you having to pause your cancer treatments. Skin changes are really common when you are undergoing radiation therapy. Anywhere from just noticing that your skin is dry, maybe a little bit red, itchy, all the way to full-blown redness, discoloration. Sometimes people even develop a blistering rash. The skin can then peel off and slough off. It can be quite serious. If you notice any skin changes in the area where you are getting radiation therapy, it is so important to bring them to the attention of your healthcare team immediately. That way they can make recommendations accordingly. If your skin becomes dry, flaky, you develop blisters, whatever you do, don't pick at these things. Don't try and exfoliate away any flakes, pop any blisters, because the skin is really vulnerable in the area where you are receiving radiation therapy. It's quite fragile and it is a lot more prone to infections and irritating stuff getting in and you developing skin problems. Skin reactions to radiation therapy, if they develop, they usually peak around 2 weeks after your treatment, and it can take several weeks for your skin to heal after completing radiation therapy. Your skin can become very sensitive when undergoing radiation therapy, so some of the tips I'm going to give you in this video can help reduce the risk of side effects like dryness, redness, irritation, peeling, itch, and even more serious side effects. You want to make sure that you are keeping skin clean. You want to wash it on a daily basis with lukewarm, not hot or cold water. The reason why cleansing is important is to help facilitate removal of bacteria on the skin surface. You want to be careful with the cleansers that you choose. You want to make sure you are choosing a body wash or cleanser that has a low pH, so an acidic formulation, to minimize disruption to your already fragile skin barrier. There are many cleansers on the market that actually have been tested in patients undergoing cancer treatments, and one of them I've mentioned before in many of my videos from Aveeno. La Roche-Posay also has a creamy wash in their Lipicare line that is another excellent choice. I will link some of these down below in the description box. You want to be really gentle with your skin though. You don't want to scrub. I suggest avoiding using washcloths, loofahs, any sort of sponge, because your skin really, that can just be way too rough on your skin and can actually really cause quite a bit of irritation and problems for you. So it's recommended that rather than doing that, you just use your hands, get a little bit of that mild acidic cleanser and gently lather, and make sure you rinse it off in total. You don't leave any of the cleanser residue behind that can further irritate the skin. Be really gentle. Another reason to abandon ship with like your loofahs and sponges and things is that they can harbor bacteria, different microbes, fungi, and with your skin being a lot more vulnerable, that puts you at greater risk for an infection in those areas. And again, make sure the water temperature is lukewarm. You really want to be careful to avoid extremes of temperature, because that can really aggravate the skin where the radiation is being directed. Number 2 is really important here, and it actually can not only help minimize the side effects of itch, discomfort, but it can reduce the risk of more serious skin toxicities, and that is moisturize. Start moisturizing before you even start your radiation therapy and continue on. You may need to moisturize even more frequently throughout the day than you ever have before, a couple of times a day. The reason this is so important is that the radiation therapy does leave your skin barrier quite vulnerable, and that can of course lead to dryness. The dryness can lead to itch, scratching. That vulnerable skin can introduce bacteria, so it's definitely something you want to try and stay on top of with consistent moisturizing. I suggest choosing a moisturizer that is free of fragrance. Again, where you are receiving radiation therapy, a lot more vulnerable. The skin may not be able to handle fragrances in skincare products And as I pointed out in other videos outside of cancer therapy, fragrance in general is often a culprit allergen or irritant in skincare products. So we suggest patients avoid fragrance in their skincare when undergoing radiation therapy. Moisturizing the skin helps with the barrier function. It helps replenish hydration in the outermost layer. So it can really help limit penetration of irritating stuff and keep moisture in the skin. And it actually can reduce the risk of more serious skin toxicities, just staying on top of moisturizing consistently. Because the skin is very vulnerable, a lot of patients undergoing radiation therapy find that in terms of moisturizing the skin, they really benefit from using a thick balm, a skin protectant. La Roche-Posay has a Cicaplast balm that has actually been investigated for use in patients undergoing radiation therapy. It's been shown to be well tolerated. The reason this is a good option to consider is that, first of all, it's a skin protectant. It has dimethicone in it, so it's nice for limiting water loss and penetration of irritants, but it also has compounds from centella, which have been shown actually to be helpful for radiation dermatitis, a type of rash, again, that you can develop as an adverse side effect from radiation therapy. So that's actually a good option. Ingredients you might want to look for in your moisturizer: hyaluronic acid may help in terms of improving moisture content, and ultimately that helps with barrier function. Niacinamide can also be beneficial because it helps improve production of proteins and lipids that are necessary for your skin barrier, and that can help in minimizing side effects. Also panthenol, squalane, these may be soothing and hydrating and moisturizing. If you do develop open sores or you have a blister that ruptures, you want to avoid putting moisturizer on an open sore. Instead, your healthcare provider, your treating team, they will probably offer you some sort of dressing, like a hydrocolloid bandage that is going to help to protect the area as well as to absorb fluid exudate that may come out, and also to, of course, protect it from infectious stuff getting in. You want to avoid, along those lines, putting any kind of sticky stuff on radiation treated skin because it is so fragile. So no bandages with tape, no adhesives, because when you remove those, the skin, because it is more vulnerable, it's more prone to tearing and for you developing sores. Because the skin is a lot more fragile, you're going to want to avoid wearing tight-fitting clothing, restrictive clothing over the areas where you are receiving radiation therapy. Choose loose-fitting, breathable fabrics that are smooth on the skin. Because the skin becomes so much more sensitive, you also want to avoid any makeup to skin that is receiving radiation therapy, as well as scented lotions, perfumes, aftershaves, and I don't suggest any sort of hair removal in that area. That includes no shaving, no waxing, no plucking. The other thing you may find a lot more irritating is your deodorants, your antiperspirants. Many patients are able to continue using those, but some have to stop. They do notice that they become a lot more irritated, either by the fragrances or in the case of antiperspirant, the aluminum becomes too irritating. I already hinted around at this when I was giving you guys tips for your bathing habits, but you really want to avoid extremes of temperature because that can lead to a lot of redness, irritation in the skin. So I suggest, in addition to keeping your showers just to lukewarm temperature, also avoid using heat packs or ice packs on the skin. This is not the time to be participating in cold plunge. I would not do that. Avoid any heating pads. Hot tubs are a big no-no in radiation therapy because they really can aggravate the skin due to the warm temperature. No sauna. Now, your skin can become very itchy as a result of the dryness from radiation therapy. So it's best to get a hold of the itch as soon as possible, because when you have itch, the response to that is to scratch the skin. You can't stop scratching, so instead we have to intervene on the itch, because scratching is just something that people do mostly without even thinking about it. It's pleasurable, but it doesn't actually do anything of benefit to you other than feel good temporarily. In fact, scratching is quite harmful to you and to your skin because it sensitizes those little nerves to release more itch compounds and make the itch persist and more stubborn to treat. Scratching also further impairs the skin barrier, so you end up with more water loss and scratching can introduce infectious stuff into the skin. So it's something that you want to avoid, but the best way to avoid it is to address the itch. So if you start to feel itchy, make sure you discuss that with your treating team, because there are medications that can be given, either applied to the skin and or taken by mouth, that address the itch. Itch is not anything to mess around with, not only because of the scratching, but it also will disrupt your sleep. And sleep is so important for healing and recovery, especially as you are going through these very intensive cancer treatments like radiation. You need your rest, and scratching can get in the way of that, even if you don't realize it, because it's these like arousals throughout the night. Then the last thing, but it's seriously really important, is you want to be very mindful of your sun exposure. Not only does your skin become more vulnerable to irritation, more fragile, but it also becomes significantly more vulnerable to the damaging effects of ultraviolet radiation from the sun. So you want to make sure you are wearing sunscreen. Recently I did a short on this, but if you didn't know, sunscreen is also a moisturizer. So wearing your sunscreen is important for not only protecting from those damaging UV rays, but also it serves as a moisturizer. It will help protect the skin from water loss, and it will reduce irritation. If you are receiving radiation therapy somewhere where the sun doesn't shine under your clothes, you don't need to worry about sunscreen there if you're not, exposing it to the sun. In addition to sunscreen, you also want to make sure that you are wearing sun protective clothing to cover the area. You are wearing hats, sunglasses, you are seeking shade, and you're limiting your time outdoors when the sun's rays are most intense. That's going to be in the midday. All right, guys, those are my tips for how to care for your skin while going through radiation therapy. One big point that I want to make, and I made in my last video, is that when you are going through cancer treatment, whether it be chemotherapy and or radiation therapy, if you notice any change in your skin, the slightest bit of redness, don't hesitate to talk to your treating healthcare team about it, because many cancer treatments have numerous side effects on the skin, and it's important to be aware of those and to notice them early, because if they are addressed early, it can help you have not only more of a comfortable treatment course, but it can minimize any disruption in your treatment course and cut down on the risk of more serious complications. I've recommended some skincare products in this video that are generally well tolerated in those undergoing radiation therapy, but always clarify with your healthcare team any skincare products that you are using and ask for their recommendations. If you guys enjoyed this video, on the end slide, I'm going to put that recent video all about skincare while undergoing chemotherapy. So check that one out next if you missed it. But if you like this video, give it a thumbs up, share it with your friends. And as always, don't forget, sunscreen and subscribe. Talk to you guys tomorrow. Bye.